Hello guys, welcome back to my YouTube channel Knowledge is Power. Today we'll be discussing a very important topic. The topic is surgical safety checklist in emergency nursing. So without wasting much time, let us start with the topic. First of all, I would like to discuss about the surgical safety checklist, about the role of the surgical safety checklist, and at last I will discuss all the elements of surgical safety checklist. So in the elements I will discuss about the sign in process, then timeout process, and at last I will discuss about the sign out process. Now, I would like to give a brief introduction about the SSC checklist. SSC checklist, it was designed to improve team communication and consistency of care that would reduce the complication of deaths that is associated with surgery complications. You all know surgery is performed in every community, wealthy and poor, rural and urban, in all regions. Although surgical care can prevent the loss of life or limb, it is also associated with a considerable risk of complications and death. In order to reduce all the complications associated with the surgery, the surgical safety checklist is followed while doing the operations. On the basis of these guidelines, a checklist is followed globally, which is applicable to reduce the rates of major complications and risks after the surgery in the diverse settings. Now, I would like to discuss about the different roles of surgical safety checklist. The checklist consists of an oral confirmation by the surgical teams. The surgical teams includes the circulatory nurse, the scrub nurse, the surgeon, the anesthesiologist. The role of surgical safety checklist, it will include the safe delivery of anesthesia by the anesthesia technician or the anesthesiologist, then the prophylactic treatment against infections, then effective teamwork should be ensured, and other essential practices during the time of surgery. The safe site surgery will help the surgical team to avoid surgical deaths and errors. The SSC also help in reducing the legal issues, surgical infection, and poor communication among the surgical team members. It is a set of safety checks has been assembled to reduce the number and severity of the adverse effects. Now, let us discuss about the different elements of surgical safety checklist. Mainly, there are three elements. One is the sign in, secondly, timeout, and at last is the sign out. So, number one is the sign in. The sign in is also known as briefing. It is done before the administration of anesthesia. Here, after the confirmation of the patient identity, the site of the operation, the name of the procedure, and after the written consent by the patient and patient family members, and anesthesia safety will be checked by the anesthesiologist or anesthesia technician. The team will also check the pulse oximeter on patient and whether it is functioning or not. Thus, the patient is having any kind of allergy. If yes, then we'll put tick in the yes option. If no, we'll tick in the no option. Then we'll check whether the patient is having any kind of airway obstruction or the patient is having any risks for respiration, and accordingly we'll put yes or no in the column. Then we'll check the risks of the operation. Next, the surgical team members will check the risks of blood loss. In case of any emergency or any procedure, if the blood loss will be greater than 500 ml, then the blood transfusion or any kind of blood product should made be ready earlier itself. And in case of children, if the blood loss is more than 7 ml per kg, then also the team members will make ready the blood and blood products earlierly. Thus, depending upon the surgery or the procedure, all these things are made ready earlier, and all these things are recorded in the OT checklist. The next element is the timeout process. In here, the team members will introduce themselves. They will introduce their name and role, their different functions. The surgeon, anesthesia professional, and nurse verbally will confirm about the patient, site of operation, and the procedure. Then any kind of critical events or any kind of surgical happenings, if it will occur during the time of surgery, like blood loss or any kind of risk factor, the team members will discuss all these events. Then nursing team reviews, they will also include the about the sterilization, about the indicators, all they will confirm before the incision. Then about the antibiotic prophylaxis also they will discuss. It should be administered before the 60 minutes of the operation, and accordingly they will prepare for the checklist in the timeout phase. Then at last we'll discuss about the sign out phase. So the sign out phase, here the nurse verbally confirms within the team what is the procedure that has been recorded, then the instruments or the spoons or the needle, how many they have used, they will count everything. Then how the specimen is labeled, whether there are any equipment problems during the time of procedure, everything they will conclude at the sign out process. Then the surgeon, anesthesia professional, and nurse will review the key concern for recovery and management of the patient. Now guys, look at this picture. In this diagram there are two pictures. One is the wrong way to do a timeout and another way is a successful timeout process. So in the successful timeout process, the nurse has reviewed everything, the key concerns for recovery and management of the patient. So this is the flow chart showing the correct way of doing timeout. The team will check whether the patient is correct. Medications and blood products will check about the correct procedure, about the surgery duration, the instruments that have been used, about the correct site, images, correct position, everything the team member will introduce themselves. Hope you all guys got brief idea regarding the topic surgical safety checklist, which is used during the time of operation. So for more such useful videos, please like, share and subscribe my YouTube channel. And if any suggestions you want to suggest, then you can comment down in my comment section below. So till then, thank you.